Transitioning from your childhood doctor to one who cares for you during your teen years and beyond can leave people with a lot of questions. And Dr. Jewett is a health expert here at Women's Care. She is going to be talking about self-care and that annual exam. So Dr. Jewett, when should a young woman get that first exam?
So transitioning from seeing a pediatrician for your health care to seeing a gynecologist can oftentimes naturally occur around the age of 18. However, there are a lot of young women who may need to see a gynecologist earlier in their teenage years. Some examples of reasons why they may want to see a gynecologist would be for problems with their menstrual periods, significant cramping with their periods. And so at a young woman's first annual gynecologic exam, some things that she might expect would be that at first we would meet with the patient and review their history, their concerns, any questions that they might have for us. We'd always want to go over any other medical history that they had, any family history that they might have too. And then as far as the physical exam and a well women's checkup, we oftentimes will do a breast exam, we'll do a pelvic exam, and then oftentimes starting at age 21, we will do Pap smears to screen for cervical cancer as well.
Would this also be a good time to talk to your doctor about contraception?
Absolutely. It would be an excellent time for us to discuss women's contraceptive needs. I also encourage patients to start talking about birth control and contraception before they actually become sexually active so that that is already in place. Another segue that leads us into would be screening for sexually transmitted diseases in our patients who are sexually active.
You talked about this a little earlier, but why is it so important to get those annual exams?
So there are a variety of reasons. One reason would be that we want to screen for certain health conditions that you might not know that you have if you weren't getting annual exams. For instance, we would want to do a breast exam to pick up any sort of breast disease. Although young women are at a very low risk for breast cancer, they can have cysts or other benign tumors of the breast. It can be hard to know if you have an STD without doing an exam and screening. And then starting at the age of 21, we also want to be doing Pap smears to screen for precancers or cancers of the cervix that one would not know they had without this type of exam.
Sometimes you only get to see your doctor once a year, so what can women be doing year-round to care for themselves?
So we would encourage young women to start with the practice of a monthly breast self-exam to check for lesions on their own. If they ever find something that they're unfamiliar with or think has changed, then they should contact us to be seen. Other things to keep themselves healthy would be sexually transmitted disease prevention, just learning how to care for themselves properly through diet changes, regular exercise. We encourage them to call us if they have any concerns at any time. So although you may generally only see a gynecologist for a yearly exam, we are happy to see you in between for any concerns you may have. So for additional information regarding your first women's annual exam, please feel free to go to our website at womenscare.com.